Welcome to New York Public Health Now. Hello, I'm Dr. Jim McDonald, Commissioner of the New York State Department of Health.
And I'm Joanne Morne, the Executive Deputy Commissioner here at the department.
So welcome back to where we talk about the why so you can decide what to do. And today we're recording again from the 14th floor at Corning Tower, Empire State Plaza. So I'm glad to have a friend of mine on, Dr. Ted Long, Senior Vice President of Ambulatory Care and Population Health at New York City Health Hospitals. Before welcoming Dr. Long, I'd like to just make sure that, Joanne, you know, Ted and I used to work together in Rhode Island many years ago.
Oh, wow.
I know, it's
great.
Rare that I actually find somebody I used to work with in Rhode Island, but Ted and I go way, way back.
It's good to have long-standing friends, so glad to join you. And I'm really delighted that Dr. Long is joining us remotely today from New York City to talk about the work with New York City Health and Hospitals, the largest public health care system in the country, which services over 1 million New Yorkers across New York City's 5 boroughs.
You know, one of our goals for the second season of this podcast is to talk to experts outside the New York State Department of Health and just talk a little bit about what's interesting to them that might be interesting to everyone who lives in New York and beyond. Dr. Long's commitment to expanding access to primary care is one I share, and I think it's a very important issue. I mean, primary care to me is one of the most important forms of care you can get. Dr. Long, the Senior Vice President of Ambulatory Care and Population Health at New York City Health and Hospitals, where he formerly directed the NYC Test and Treat Corps, New York City's comprehensive effort to provide accessible COVID-19 testing free of charge, as well as connections to treatment.
And just as a little bit of history, Dr. Long previously served as Senior Medical Officer for the Quality Measurement and Value-Based Incentives Group at the Centers for Medicare and Medicaid Services. There he led more than 20 federal programs. Before that, Dr. Long served as Medical Director at the Rhode Island State Department of Health, where he led healthcare planning for the state. Dr. Long earned his medical degree from the University of Southern California's Keck School of Medicine and did his undergraduate work, residency training, and postgraduate master's work in health services research at Yale University. A clinical professor of NYU Langone's Department of Population Health, Dr. Long also serves on the faculty at the Yale School of Medicine and the Harvard Medical School Center for Primary Care, where he teaches about health policy and administration.
You know, and in case you didn't think Dr. Long was busy enough, he's authored more than 50 peer-reviewed articles that have appeared in journals such as JAMA, Nature, Lancet Public Health. So, Ted, good to have you with us today.
Thank you. It's an honor to be with you all.
So, Ted, why don't we just start I know we talked a little bit about you. Why don't you tell us a little bit about yourself?
Yeah, so I, first and foremost, am a primary care doctor. I'm a primary care doctor in the Bronx. I've seen my patients throughout COVID. I saw my patients before COVID, and I see my patients every single week now. And the way that I view healthcare is I view healthcare as a human right. The front door of that human right means that everybody must have access to a primary care doctor like me to be your quarterback, to make a plan with you and to help you to execute on the plan for your health coming from you. And going forward, I'm looking forward to telling you about some of the ways at New York City Health and Hospitals that we make healthcare right in New York City every day, extending healthcare access to hundreds of thousands of people that previously didn't have it.
Yeah, that's awesome. That's great. And I think of primary care almost as just like the connective tissue throughout your career. And I think people sometimes have different concepts of what exactly primary care is. But why don't you just tell us, what is the scope of primary care?
So primary care is the front door to the healthcare system, or in other words, because healthcare is a human right, it's your front door to being able to access that right. Whether you're a New Yorker that's been here for 50 years, 50 days, or 50 minutes, healthcare is still your right in New York City. Primary care to me is for my patients, I'm their quarterback. I first and foremost listen. I hear what their priorities are. I diagnose them with conditions and we make a plan together. But as their quarterback, my job is to make that plan and help them to execute on that plan for their health. Whether that's diagnosing one of my patients with a chronic condition, helping them through something acute, being able to solve a problem that day, or passing the ball to a specialist if we need to ask for help from a cardiologist, a pulmonologist. But whatever we need from the words of my patients to me, that's what my job is, to move heaven and earth and to do everything in my power to get them what they want, to make them as healthy as I can make them.
Wow, that's amazing. I really very interesting to hear you talk about your commitment to the patients and all that you do in that process. So we're hoping today that we can talk a bit about the New York City Care. I wonder if you can start by telling us about the vast network that got it started, including New York City Health and Hospitals. We know it's the largest public health care system in the country. I know that was said earlier as well. So what does that mean, and what does it all encompass?
Yeah, so New York City Health and Hospitals, we refer to ourselves as the largest public healthcare system in the country. Another way to put that is that we're the largest municipal or city-run public healthcare, meaning hospitals and clinics system in the country. In particular, in New York City, we have 10 hospitals on 11 different campuses, with hospitals as large and famed as Bellevue Hospital. And overall, we have about 50 community health centers and outpatient or primary care practices within our hospitals. So we're in every single borough. So wherever you are, we want to see you in primary care so that we can do everything that we can to help you to achieve your goals and keep you and make you healthy.
So let's pivot to NYC Care, which was launched in 2019, right before the pandemic. So you can talk about how and why it got started. And by the way, is this a health insurance program?
NYC Care is a program that is very near and dear to my heart as a primary care doctor, and really I think is emblematic of our mission and how we can really help people in New York City. I'll actually tell you about the program through the eyes of one of my patients. This was my first NYC Care patient that I saw back in 2019 in the Bronx. And I remember she came into my office, she was a new patient, and the first thing that she shared with me was that she hadn't seen a doctor in 43 years. Meaning she hadn't had access to having a mammogram, a colonoscopy. She didn't know if she had diabetes. She hadn't been up to date in her vaccines. She hadn't had all of those elements that really constitute her human right to be able to live a healthy life in our country. But that day, all that changed. That day, I brought her up to speed on all of those preventive healthcare measures that she'd literally never had before. Talked to her about everything we were doing, all the labs we were going to send off to make sure that we knew what was going on with her body. And at the end of it, I couldn't resist but asking her, I said, why today? It had been 43 years. You could have always come to New York City Health and Hospitals. Why? What changed today? Why did you come to my office today? And she started crying. And she said that she, before today, didn't believe that she deserved medical care. I then, of course, started crying too. And we had a really special and important moment because she that day felt for the first time that she deserved her human right of healthcare. And the reason that she came to my office that day was because of the NYC Care program. You can and should come into primary care at New York City Health and Hospitals. And there's availability, there's access. Call this number, 646 NYC Care. And they'll take care of you. They'll change your life, as I took a small step forward to changing the life of my patient who, again, hadn't seen a doctor in 43 years.
You know, I'm trying to process someone feeling like they didn't deserve to see a doctor, because that's a lot, you know, and I think that's really, to me, emblematic of just, I love the way you talk about primary care as a human right. I mean, to me, quite frankly, when you don't have health insurance, it's uncomfortable. It really is. But it's not really health insurance. It's really... You're just welcome at every health and hospital's primary care clinic, and they're not going to charge you. Is that what it is?
So NYC Care is health insurance like, if you will. It's an access to care program. And if you take nothing else away from the program, it's that it's a safe place where everybody can come to access care, starting with primary care, without exception, regardless of your immigration status or ability to pay. For my patient, it was that place that she... on some level had been looking for 43 years, but didn't feel like she'd found until she saw the advertisements for the program. She called the number, realized she could get into care. And when she stepped through my office, the reason that she was crying at the end of our visit is that she felt for the first time that she, again, deserved care and had been able to access care. So it is an access to care program for everyone. And all you have to do is call 646 NYC Care, and we will offer you an appointment within 2 weeks.
So Does someone pay to be part of the NYC Care program, or do they have to pay at the visit, or is it paid by someone else? How's the money work?
So we have a fee scale based on your individual income. And just because cost is certainly a barrier to people being able to access care or feeling like they can access care, we actually print for you on a card that we send you, a membership card to the NYC Care program, your individual fee scale, or copay as some people like to refer to it, for any type of visit, ranging from seeing me in primary care, needing to go to the emergency room, or needing a medication. So you never have to worry about the uncertainty of how much it could cost, whether it's $2, $4, $10, whatever it is. Your individual payment will be on your card. So before you even see me, you'll know exactly what it's going to cost, and you can plan ahead.
So is it really affordable? Like, is it $2, $6, $10 to go see a doctor? It's that affordable?
Yeah, actually, for many people, they don't make enough money to even enter into our fee scale. So for many New Yorkers, it actually is free. But if you do, based on your income, make enough money to trigger our fee scale, which is the same as we use in our FQ, Federally Qualified Health Center, then there would be small payments that you'd make based on that. For many people, to answer your question, $2 is the real amount that they would pay for medication. $0 or $2, I believe, are the most common amounts paid or not paid.
So in 2023, NYC Care members scheduled more than 200,000 visits with primary care providers. So as a practicing primary care doctor, can you talk about the importance of primary care and why it matters?
The NYC Care program in 2019, we didn't know how it was going to go. We didn't know how many people would enroll. We set a goal of being able to enroll 100,000 New Yorkers that were going without into the program. And the exciting update that we have is that recently we surpassed 125,000 New Yorkers that are now part of the NYC Care program. So all of them now have the ability to, in a cost-effective way for them, get all the preventive care that they were going without, get the vaccinations they were going without, be able to talk to a doctor like me to understand what's going on with their bodies or to answer any medical questions that they would have. And about half, I think it's just over half, of all of the people that enrolled in the program were new patients. In other words, didn't necessarily have a primary care doctor or hadn't seen one in a very long time. And that's why it's so meaningful to me that my first patient as a primary care doctor for the NYC Care program hadn't seen a doctor again in 43 years.
Wow. The life story that you share about the individual who hadn't received care in 43 years is so impactful. It's amazing what we will deny ourselves if we feel that we're not worthy. So thank you for creating a space for people to feel worthy.
Yeah.
So for anyone just joining, we are speaking today with Dr. Ted Long, Senior Vice President of the Ambulatory Care and Population Health at New York City Health and Hospitals. And you have been talking about the New York City Care or NYC Care program and the fact that you've surpassed the goals as far as enrolling 100,000 individuals. Is there a limit or a cap as to how many people can be enrolled?
No, there is not, and we will keep going until we've enrolled every New Yorker that wants to access primary care in the New York City Health and Hospital system. In my mind, again, healthcare is a core human right, and the way that we meet that right as a city and country starts with giving everybody access to the front door of the healthcare system, and that's primary care. So again, we started off with the goal of having 100,000 New Yorkers be able to access their human right of starting primary care in our system. We've now blown past that because I think many other New Yorkers have gone and told their friends that there's this program where they can finally get the care that they deserve. And now we've passed 125,000 members, and we're still growing every day.
And it sounds like more than just open doors. It sounds like you're offering compassionate care, which is just amazing. So my understanding so far from our conversation, NYC Care provides access to primary care visits, behavioral health, medication, emergency services, and further examples like that. I know you talked about the cost to the individual, but where does the funding actually come from?
Yeah, so the funding for the program both comes from the fee scale of the individual and also comes from New York City that's chosen to invest in this program, which to me makes me incredibly proud to be a New Yorker because there's no better way to stand behind our conviction that healthcare is a human right than to invest in a program like this, which literally gives access to that right to that healthcare for over 125,000 people a year.
So what kind of positive health outcomes are you seeing for members enrolled in NYC Care? I mean, you think the program's working?
Yeah, I mean, for me, I'll tell you, Dr. McDonald, when my first patient, again, who hadn't seen a doctor in 43 years, was sitting in front of me crying because she was able to finally access health care that she didn't previously felt like she deserved, that was it for me. I would have considered the program a success on day one.
Yeah, no, I'm with you, yeah.
But going forward from there, we've actually seen some very interesting outcomes. And I think the basis of a lot of this is that so many people had been going without in New York City, and this program made them finally believe that there was a safe place for them to access healthcare, which I think at everyone's core, everybody wants to make sure that they're healthy. But again, there's a variety of barriers that prevent people from getting the care that they need and that is their right. But once we've been able to remove some of those barriers with the NYC Care program, we've seen, for example, over half of the patients in our program that have diabetes or high blood pressure have had an improvement in their diabetes or high blood pressure since enrolling in the program. Maybe more impressively than that, nearly 3 out of every 4 people enrolled in the program after having been in NYC Care for 6 months have controlled their diabetes and controlled their high blood pressure.
Yeah, that's impressive.
So I think that just goes to show that so many people didn't even know they had diabetes or high blood pressure. They enroll in the program, they have me as one of their doctors, and we're able to really control a chronic condition that, again, they might not have known that they had, but once they know they have it, we will move heaven and earth to help them.
I think that's just a great example, though, because if you control diabetes, you're less likely to go on to have heart disease or kidney disease from that. And if you can control hypertension, you're less likely to have a stroke or a heart attack. And I think it really gets to that, that old adage, an ounce of prevention is worth a pound of cure. I think about the primary care provider, which I've been one for over 33 years. So often it's just, come see me. I'll try my best to keep you well. If you're sick, I'll try my best to make you well.
Perfectly said.
But, as a primary care provider, you'd be amazed what I can do to keep you healthy.
I know you've talked about who is eligible to enroll in the program, also about the great partnership with community-based organizations that truly have the relationships with members of the community. Can you talk about enrollment? What's the process to actually be enrolled in the program?
Yeah, thanks for asking that. So to enroll in the program, we wanted to keep it simple. All you need to do is call 646 NYC Care. Allow me to repeat, 646 NYC Care. And you or friends or family can enroll in the program just like that. As part of enrollment, we do want to check to make sure that you're not eligible for insurance in New York State. If you're eligible for an insurance plan, we want to encourage you and help you to enroll in that plan. So for example, Metro Plus, which is part of our healthcare system, has been an instrumental partner in helping us to get people either enrolled in health insurance or enrolled in this program. And the enrollment in this program, if you're not eligible for health insurance, is a simple process. We ask a couple of questions, including about your income, just so that we can print on your card, again, your precise fee scale or the amount of money you would have to pay as an individual for any of the services we offer, ranging from your cost of a medication to a cost to see me. We want to make sure that we're tearing down that sort of lack of transparency cost barrier that many people perceive so that you can feel comfortable getting the care that you deserve.
That makes a lot of sense. So if someone calls 646 NYC Care, it's a brief interview process, but one of the first questions is, maybe you're eligible for Medicaid. Maybe you're eligible for one of the affordable care insurance plans, like the Essential Plan members we have out there. So we often talk about the Essential Plan in New York State. So if you don't qualify for those insurance, NYC Care will kind of fill in the gap there, and then you have an access to care product. Because really, it's not an insurance program, it's an access to care program, as you've said. And I understand since 2019, enrollment's up nearly 400%. What do you think are the main drivers of the program's rapid growth? And any particular success stories, by the way?
Yeah. So, it's very interesting for me, again, as a primary care doctor, to think about why the program has really exploded and grown as fast as it has. Because we at New York City Health and Hospitals, for all practical purposes here, have existed forever. We've been in New York City for a very long time. Bellevue has been around for hundreds of years. And it's true that my patients in the Bronx could have always come to us, but it's also true that they didn't come to us. In fact, they didn't seek healthcare at all. And that is my proof of that is my first patient who hadn't seen a doctor in 43 years. I think what the program really uniquely did is it showed people that we could tear down these perceived barriers of accessing care, of cost. And I think one of the ways that we did that is we really did focus on improving access to care before we started this program. It was the first thing I did when I joined New York City Health and Hospitals over 6 years ago. Again, as a prideful primary care doctor, I said, we need to do everything we can to make sure that we have good access to primary care for every New Yorker. And it used to be that our wait times were not so good. It used to take over a month to get into primary care at New York City Health and Hospitals. We were able to cut that down to 14 days, then below 14 days. So imagine yourself, if you're a new patient that wants to seek primary care, if you call us and say, you want to come into our system, and we say it's going to be a few months, not very motivational for you to follow through, and you certainly aren't going to go tell your friends and family you had a good experience. What if we can offer you an appointment in 10 days? Well, then you're going to get in much quicker. You're going to have a better experience from the get-go, and you're more likely to go and tell your friends, hey, there actually is access to care now at health and hospitals. So that was one of the first things that I focused on that we changed. Again, we cut the wait times down by more than 50%. Then we started this program. So I think that to answer your question, that was a really important piece of the puzzle, is by improving access to care at its core in our system, we were able to make a very public commitment to every New Yorker that we would offer you an appointment within 2 weeks with your new primary care doctor. And we delivered on that. I believe it was 97% of the time for the first several years. But I think that proved to people that we were serious and that we really cared and we were standing behind what we said. And I think that made a big, big difference in being able to have this program succeed in helping people.
And as described, it sounds as if you certainly have a very proven effective program. So based on that, I just wonder if you're seeing other models around the country that are similar or replicated from NYC Care. Are you getting calls from other public health officials saying, we want to increase access to care too, how do we do it?
Yeah, I love that question. In San Francisco and Los Angeles, there have been programs with a similar basis to NYC Care. Now, in California, they're making a variety of insurance changes. So NYC Care is certainly, I think maybe now is the largest program of its type, which is a universal access to care program. But to answer your question, and this is, I will give my public commitment to this, I would love to talk to any city or state in the country about our program. I really believe in it. My patients have shown me and told me how important it is to them. And I think the fact that we've been able to get nearly 3/4 of all of our diabetic and hypertensive patients under control, which could save their life, I think every city or state in the country could consider a program like this. And I'd love to tell them how we did it, share best practices, and see what's possible across the country.
We've been talking today to Dr. Ted Long from Health and Hospitals about NYC Care. When we talk about the why, this is an access to care program. Why it matters is everyone really needs to have a primary care provider. It's a great way to prevent having long-term disease and chronic disease is to have a primary care provider, find your problem, get the help you need. Everyone needs to have a doctor. And it's been great to have you represent Health and Hospitals today. And, I did visit Bellevue last month, and you're right, it is an iconic structure in healthcare in America. It really is quite an icon. It was great for me to visit there. So Ted, thank you for joining us today.
It's been an honor to join you both, and it is an honor to be a New Yorker under your leadership, Commissioner McDonald. So thank you for having me.
So as season 2 of our podcast, New York Public Health Now, comes to a close, we're going to take the summer off and look forward to joining you again in the fall. We'll have more guests talking about more public health topics of interest to everyone. If you have a topic you want us to talk about it, go ahead and send us an email, publichealthnowpodcast@health.ny.gov. For New York Public Health Now podcast, I'm Dr. Jim McDonald.
I'm Joanne Morne.
And I'm Dr. Ted Long.
And thank you for listening.
New York Public Health Now is a production of New York State Department of Health's Public Affairs Group. Michael Wren is the executive producer and engineer, with additional production support provided by Sarah Snyder, Janine Babakian, Barbara Stubblebine, Alicia Biggs, Monica Pomeroy, and Kyle Koteri. Copyright 2024, all rights reserved. We welcome your feedback. Please email us at publichealthnowpodcast@health.ny.gov.